Good afternoon. This is Dr. Hart, and this is a little lecture on anxiety, obsessive compulsive, and related disorders. So this is just a little talk about anxiety. Anxiety is a necessary type of thing for us people. It's part of our fight or flight, so it's necessary for our survival in order to be able to say the old saying, there's a bear in the woods, and you either fight or you flight. So it's part of our internal system, and it's the response to a stressor that's coming at you at that time. The problem is some people are not able to deal with their anxiety, and it gets out of control, and they need some help with that, dealing with their anxiety. And this is a lot of people that suffer from anxiety and OCD. OCD are the obsessive compulsive disorders that I will talk about. It's considered a disorder under the DSM-5 for mental health disorders. It can be culturally defined depending on the culture, and the source is unknown. Can be genetic. And anxiety is a medical diagnosis, and it can, when you're writing your care plans, it can also be a nursing diagnosis. So the problem is, this problem begins for people who have too much anxiety, and it gets out of balance, it gets out of control. The person is not able to control their anxiety. And the other way that your patient may be able to tell that your anxiety is out of control is if it's starting to affect your interpersonal relationships, your relationships with friends, family, other acquaintances, and you may have problems interacting or maintaining occupational functioning, which means the person is having trouble maintaining employment, which is vital for most people to be able to keep a job. And that's how your whole life is affected. When you aren't able to maintain relationships with other people, and you're not able to maintain employment. A panic attack, it's a sudden someone having overwhelming feeling. Person having a panic attack is going to feel like they may die. So these are the symptoms: sweating, shaking, there may be chest pain. So in the case of chest pain, we have to, as nurses, we have to take that very seriously and have them checked out. Get an EKG, whatever the doctor orders for chest pain. We don't take that lightly. We do follow-up labs for chest pain. And then we may find that it was anxiety, and then we can treat the anxiety, but at least we know it's not directly cardiac related to the person. There may be fear of losing control. You feel like you're going crazy, and there's also a fear of dying. This slide has derealization and depersonalization. Those are two things that I will talk about more on the video on somatic and dissociative disorders. The derealization is a distorted perception of the external world. The person is feeling detached from their surroundings. The depersonalization is the feeling of being detached from yourself. It's kind of an obscure, abstract idea, and it is difficult for most people to understand those terms. Okay, panic disorder. This is when a person has continues to have more and more panic attacks. If you have a patient who is having a panic attack, the thing to remember as the nurse is not to leave them by themselves. Do not, if you have a patient who's having a panic attack, do not leave the room. Okay, stay with the patient until help comes. Generalized anxiety disorder, that's a medical diagnosis, GAD abbreviated. You may see this in a lot of test questions, so you have to know what it is. Okay, these are chronic, unrealistic, excessive anxiety and worry. Unrealistic being the key word. And someone may have anxiety that they can deal with. They can watch relaxation videos, they can do yoga, exercise, other means to help them with their anxiety. There are a lot of relaxation videos that your patient can watch that you can recommend. But the general anxiety disorder diagnosis means that there is chronic, that's constant or continual excessive worry that is unrealistic. Okay, there isn't really any organic factor. It's not too much caffeine. It's not a physical factor. And it's going to show up as muscle tension, restlessness, feeling keyed up, and they may even have, like I mentioned, they may even have chest pain. This may result in a negative outcome for your patient, so we have to take this very seriously. Okay, phobias. I mentioned, I talked a little bit about phobias on another presentation where I did test questions. I did some NCLEX style test questions for you to look at, read, and practice. And one of them was on phobias. So these are, again, irrational fears. There are so many of them, different types. You can have a fear of elevators, a fear of animals, a fear of dogs. You can have a fear of going over a bridge, a fear of flying in an airplane. So this can be a fear of a specific thing or an activity, a situation, an environment that a person is afraid of, some kind of stimulus. The response to these fears can be so severe that the person goes into a panic attack if they get on an elevator. Some of the phobias, different types. Okay. This may be aquaphobia. Aquaphobia was actually in the test question that I did. That's the fear of the natural environment, which is water. Agoraphobia is the fear of being in open places, more specifically the fear of being vulnerable in a social setting and not being able to get help or escape the setting. Claustrophobia, fear of confined spaces. Many people have that phobia. Mysophobia is the fear of dirt, germs, and contamination. There's even a social anxiety disorder. This is an excessive fear of situations where the person's afraid of doing something embarrassing in front of other people and afraid they're going to be negatively judged by others. And you can imagine with social media and the mean people that get on social media to talk about other people. And when I see many posts of people trying to share what they're going through, and the public is commenting very mean and nasty comments. That makes it very difficult, and someone with that type of phobia or social anxiety disorder is really going to have a tough time in that situation. So that's the fear of being exposed to possible scrutiny or judgment by other people. Fear of speaking in public, fear of eating in public, fear of using a public bathroom, or fear of saying something that might be judged by others or may provoke laughter. Someone who says something different and they see other people laughing about them. Exposure to these phobias will usually result in feelings of panic, anxiety, sweating, tachycardia, and dyspnea, which is tachycardia is a pulse over 100, and dyspnea is a shortness of breath. So these feelings are very real for these patients. And these are everyday people that you see every day that are going through anxiety to this point. So we need to be, as nurses, non-judgmental, non-biased. Keep your thoughts and your attitudes at the door and walk in the room, patient's room, and just treat them the best that you know how without judgment or bias, okay? Okay, then we have obsessions. Obsessions and compulsions. So obsessions are the ruminations. Ruminations are unrealistic, repeating thoughts that and it's hard for the person to get those to stop until they get into therapy and get medications and learn how to get those recurring thoughts to stop. Those are also images in your mind. You're not able to get those to stop. And then we have the compulsions. Compulsions like hand washing, checking. I mentioned on the other video, checking the stove to make sure you didn't leave it on. Imagine before you can leave your house, you're always thinking you left a stove on or you forgot to lock something. So you have to repeatedly check things, going back and forth. That can make it very difficult to get, say, if you're on your way to work, that's going to make you late for work, and that's going to cause you to possibly lose your job and get fired. So that's going to affect their ability to be gainfully employed when they have to keep checking things and having to take so many steps or counting steps everywhere they go, or having to touch something multiple times before they can release that anxiety. So the compulsion is the way that someone is desperately trying to release that anxiety that they're having. So other compulsions are hair pulling. These are real things. Hair pulling disorder. The person is pulling their hair, trying to have a relief of tension. That person may even ingest the hair, and that can cause serious gastrointestinal issues. There's hoarding disorder. One of my favorite shows is hoarding. I don't watch it not at all to make fun of people. I watch it to learn about these disorders. It just fascinates me to be able to learn more and more. A lot of the hoarding disorder people on the show, a lot of them have had multiple deaths in the family, or that they have not resolved. They have not gone through the grieving process, or they've had usually some kind of trauma in the childhood, whether it's sexual trauma or neglect or very poor, not having anything. So they grow up as adults and now they want to hoard of food that they never had. They want to hoard the things that they never had as a child. So the hoarding disorder is having the person that's having difficulty getting rid of things that are even dangerous, dirty, or don't have any value. There are even people who hoard pets and animals, and that's unfortunate because they hoard so many of them that they're not able to take care of them. And the excessive acquisition disorder is the excessive need to acquire things. Kind of goes along with the hoarding disorder. Okay, so this is Monk. He is a character on a TV show. There's a link to a video. We're going to watch a short video on hand washing. It's funny, but not funny for someone who's going through this. It's a funny show. It's kind of a funny takeoff on someone who's going through obsessive and compulsive disorders. So the man in this show, Monk, in the show, his wife was murdered. So after that happened, he began to have unrealistic and anxiety to the point where it could not be resolved. And so his obsessive, he obsessed mostly on germs, having a fear of germs, and his compulsions were hand washing. His compulsions were also checking and touching. It shows him in the beginning of the show walking down the street, and there are parking meters every so many feet, say every 5 feet or 10 feet there's a parking meter, and he's walking down the street and he has to touch every parking meter as he walks down the street. That's part of his ritual. Helps him to relieve his anxiety. And of course, in the show, he is a police investigator. He had to take time off, obviously, when his wife died, but then he came back to his job, and now his goal was to find his wife, find out who murdered his wife. So it's a cute show. It's an old show. You can find it on YouTube probably if you wanted to watch it. This is a short video that we're going to watch. If I can get this link to work, I'll just copy the link. No, I can't just get this to work. Okay, so anyways, play this video. Here's the link. Okay, when you have time. It's really cute. It shows Monk in the beginning washing his hands obsessively, and the reason he's washing his hand is because he was exposed to someone. He shook hands with someone who had leprosy. Well, leprosy is a very rare, curable disease disorder. It's a bacterial disorder. So Monk goes to the doctor, and the doctor educates him about leprosy, and there's no fears, and he can be treated for it. But it's just very funny the way he deals with it, the hand washing. Okay, so these are some of the manifestations of obsessive compulsive disorder, or OCD. This is how your patient is going to present to you. They may have obsessions, compulsions, or both of those. And these obsessions and compulsions are so severe that, again, like I mentioned, they're going to interfere with their ability to keep a job and social, interpersonal relationships. And so this is how the obsessive compulsive disorder is diagnosed by a psychiatrist, showing these signs and symptoms. So some of the most common compulsions are hand washing, ordering, checking, praying, counting, and repeating words silently in order to alleviate the person's distress and anxiety. This is the assessment part of the nursing process that I like to cover. This is body dysmorphic disorder. This is a disorder where the person is feeling that their body is out of whack and it's not functioning properly. My body is completely malfunctioning. And so it's exaggerated, it's unrealistic, and again, it's going to affect the person's ability to maintain interpersonal and occupational functioning. They have the feeling that their body is deformed in some way. This may be wrinkles or scars, the shape or size of their nose, their hair, their eyes, lips, teeth, stomach, genitals, or body weight. Sometimes a true defect may be present, sometimes it's not. And they may also have comorbid mental disorders that go along. These are mental disorders that go along with the body dysmorphic disorder. They may have major depressive disorder, anxiety disorder, and other psychiatric disorders. And body dysmorphic disorder is a psychiatric diagnosis from the DSM-5 statistical manual. Here's hoarding disorder that I mentioned. This is the continual collection of things, whether they can be food, they can be items, they can be pets and animals also. Some of the people on the show, they acquire things by purchasing them. Some people visit dumpsters. Some people steal from others. Some hoarders have stolen things from their family members. And it's more men than women, but on the show I've seen kind of an equal amount of men and women that are suffering from hoarding disorder. They're having difficulty parting with possessions, even if they're sanitary. So the food may be spoiled, the refrigerator may be full of spoiled things, but they're still not able to get rid of those things. Okay, these are the nursing diagnoses. I know these aren't used as much on the NCLEX, but in your nursing school, whatever school you're attending, you may still need to do care plans for clinicals. Okay, so some of these I still like to cover some of these nursing diagnoses that are commonly used for anxiety, OCD, and other related disorders. Panic, anxiety, powerlessness, fear, social isolation, ineffective coping, ineffective role performance, and disturbed body image, which is the body dysmorphic disorder that I talked about. If you're designing a care plan for your patient with anxiety, obsessive compulsive, and related disorders, the nursing diagnosis of panic anxiety, I'm going to go through some of the nursing interventions. The most important nursing intervention I feel for panic anxiety is to stay with the patient if they're going through a panic attack. Reassure them that they are safe and secure. And don't ever leave a patient alone who is having a panic attack or anxiety. Outcome criteria, that would be goals for your patient. some of the goals for a patient with these disorders would be for them to recognize when they're getting anxiety is escalating and intervene before they reach the point of a panic attack, or seeking help before they reach a panic attack. Taking a medication. We're going to talk about medications at the end of this. Reaching out to possibly a therapist, reaching out to a social network that they have in order to get some help from the outside before it gets to the panic level. And that's being able to recognize that anxiety before it gets to that point. Maintaining their anxiety at a manageable level, function in the presence of the phobic object or situation without having a panic attack, verbalizing a plan of action and how you would respond, how they would respond to the phobic object or situation without having a panic attack, able to manage anxiety without using the ritualistic behaviors like the hand washing, showing more adaptive coping strategies, verbalizing a realistic perception of themselves for the body dysmorphic disorder. Their goal would be to be able to demonstrate a realistic view of themselves. Another obsessive compulsive disorder is trichotillomania. That's hair pulling. So the planning phase or implementation phase of the nursing process, anxiety and fear. Okay, some of the outcomes or patient goals. Okay, the patient will verbalize ways to intervene in escalating anxiety within 1 week, right? Remember, they should be SMART goals. Specific, measurable, attainable, realistic, and timed or time-bound. For the nurse, nursing interventions. Don't leave a patient who has experienced a panic anxiety alone. Stay with them, reassure them that they are safe. For the nurse, maintain a calm, non-threatening, matter-of-fact approach. Okay, if you have anxiety and you're bouncing it off each other, that's not going to do any good for the patient. Patient is just going to get worse. So you as the nurse needs to show the matter-of-fact, non-threatening, calm approach. The nurse should use simple words and brief messages, speak calmly and clearly, explain hospital experiences. You know, they found in studies that when the patient is first admitted, if you show them where the call bell is, show them how to get to the bathroom, show them where the bathroom is, take a minute to orient them to the room. Okay, that can reduce their anxiety. Okay, so hyperventilation may even occur in periods of extreme anxiety. Hyperventilation causes the amount of CO2 in the blood to decrease because you're expelling too much CO2. The person can become lightheaded with a rapid heart rate, shortness of breath, numbness or tingling in the hands or feet, and syncope, which is fainting. If you have a patient going through hyperventilation, you can help the patient breathe into a small paper bag held over the nose and mouth. Okay? 6 to 12 natural breaths should be taken, alternating with short periods of diaphragmatic breathing. This will help them to rebreathe the CO2. Okay? And that will help with that lightheadedness. keep them from passing out. Also, the nurse should keep the immediate surroundings low in stimuli, dim the lighting, less people. A less stimulating environment can lessen anxiety. The nurse will, if the doctor has ordered, administer anti-anxiety medications. Whenever you give medications of any kind, you're going to assess the medication effectiveness and assess for any adverse side effects. When the patient's level of anxiety has declined, you can talk with the patient and explore the reasons for why they had this anxiety. The nurse should teach the patient signs and symptoms of anxiety, escalating anxiety, teach them how to do relaxation techniques, deep breathing exercises, brisk walk, jogging, meditation. The evaluation is the last phase of the nursing process. Okay, the reassessment is conducted to determine if the nursing actions have been successful, and that may be part of your nursing care plan that you need to write for clinicals. Okay, so the evaluation phase is where the nurse is evaluating whether or not their nursing interventions were effective. They're evaluating whether or not the medications were effective, was the therapy effective, and so on. These are the treatments. Cognitive behavioral therapy has been shown to be very successful for a lot of people. Systematic desensitization and implosion therapy or flooding. Okay, this is where the patient is gradually exposed. This is for phobias and anxiety caused by phobias. They're gradually exposed to the phobic stimulus, either in a real or imagined situation. So most times they're in the therapist's office. They're in a safe place. In implosion therapy, the therapist will flood the patient with information concerning the situations that trigger their anxiety. The therapist describes the anxiety-provoking situations in vivid detail and is guided by the patient's response. The more anxiety provoked, the more faster the therapeutic endeavor. So it's more successful if there is the more anxiety provocation that the patient can tolerate. And of course, they're going to be monitored in the therapeutic environment. Okay, and finally, these are the medications that are sometimes used. So again, there isn't one particular medication. Medications are not, they're trial and error, unfortunately, and they probably always will be. They are for anxiety and depression disorders. Okay, there are multiple medications that may be tried and used. SSRIs are selective serotonin reuptake inhibitors. Okay, SNRIs, anti-anxieties. Okay, sertraline, paroxetine, venlafaxine, duloxetine, anti-anxieties. These are the drug classes, benzodiazepines, and the ones in parentheses and italics, those are the examples. So an example of benzodiazepine is diazepam. Buspirone is Boost Bar, brand name Boost Bar. That is a not a controlled substance. Boost Bar is used successfully for many people because you can take it every day. It's not habit forming like the benzodiazepines are. Okay, benzodiazepines are very addictive. Beta blockers are also used. I've seen those used in the centers. I use them many, many times in the centers, detox substance abuse centers that I worked at. Propranolol is a beta blocker that's used. That's the example. They do decrease blood pressure and pulse, so be careful. You have to assess before and after you give those. Any medications you should be assessing before and after. Antihistamines and anticonvulsants. Under antihistamines, I want to talk about hydroxyzine for a second. Very good, very successful, brand name Vistral. Very used a lot for anxiety in all of the centers that I worked at. It's not a controlled substance. It's not addictive. So it's very good, usually on the chart as a PRN, as needed medication. Great medication for anxiety. Okay, so that's it for this little talk on anxiety and OCD. If you are getting help or enjoying these videos, please like, share, and subscribe if you wish. And we'll see you on the next one. Have a great day.